moving on to our next talk, I would now like to invite Dr. Avninder Gupta. Sir, he'll be talking about using micro scissors and forceps, another tool which we VR surgeons routinely use for our uh, VR surgeries, how we can use those tools to help reconstruct anterior segment. Over to Dr. Gupta.
First of all, I'd like to thank Dr. Ritesh for giving me this opportunity. I'll be talking about micro scissors and forceps in anterior segment reconstruction. Uh, in the area of super specialty, many a times we are unaware what is happening in other specialties, and we also forget to peep into other specialty about the new instrumentation what we get, the machines, how can they help in your specialty. And somehow I feel retina is one specialty where the machines are more developed, the instrument are more microsurgicals, because we are doing 23 and 25, 27 gauge surgeries. Uh, 23 gauge and 25 gauge micro scissors and forceps were first introduced in vitreoretinal surgeries. These instruments have found way into various anterior segment surgeries, and one of these surgery is pupilloplasty, a surgical procedure to alter the shape or functions of the pupil. And this has also helped us in doing D6 and glute IOL. This is one of the patient of traumatic subluxated cataract with mid-dilated pupil. MICS with endocapsular ring with IOL was done. Patient had 6/6 vision. Halos due to edge effect of the IOL was disturbing. That patient was not able to work. So what we did here is a septal snot. You can see the large dilated pupil, the subluxated lens. Pilocarpine was introduced into the eye, and you can see a constriction of the pupil. A paracentesis was made at 2 o'clock position. A 10-0 needle on Marceline suture on ST-T6 needle was introduced into the eye, and the iris tissue was taken into the needle, and then it was docked into the cannula and brought out of the paracentesis. Once the needle is brought down, you have two sutures here. This suture edge we'll call it as a distal suture, and this we'll call it as an proximal suture. So what we do now, we go within 23 gauge forceps and pull the proximal suture out. And now what we see here is there are three sutures. This is 1, this is 2, and this is 3. So you cut this suture from here, and from this suture you will take a loop. And if you take 3 loops, then you will have to do a 3-2-1 type of a loop. And if you take 4 loops, that we call as an 4-throw pupilloplasty, you won't have to take 2-1 loop again. So the suture 4 throws are taken, and these 2 sutures are pulled, and you can see the knot sliding inside, and this we call as a sliding septal knot. And the second throw is taken, and at the end of the surgery, the sutures are cut with the help of a 23 gauge curved scissors. And you can see 2 millimeters round pupil. And at the end of the 1 day post-op, you can see a nice 3 millimeters pupil. There was no glows or halos, and patient was now able to drive and do his normal activities. This is one of the patient who had subluxated lens with retinal detachment. So we did a lensectomy, vitrectomy with silicone oil. You can see a large inferior SI. This is an emulsified silicone oil. So what we planned in this patient was aphakic. So we planned to remove the silicone oil from the anterior segment after putting viscoelastic. Flaps were made at 3 and 9 o'clock position. The IOL was inserted, and the tip of the IOL was caught with the help of a 26 gauge forceps and then externalized temporally. The assistant holds this haptic. The second haptic is internalized and then externalized. Once both the haptics are externalized, it is internalized into the scleral tract, which we create with the help of a 26 gauge needle. Uh, After doing glued IOL surgery, what we did is pupilloplasty again. This is fourth row pupilloplasty. The iris tissue is engaged into ST6 needle and then docked into an cannula. The proximal suture is brought out with the help of a 23 gauge forceps. Fourth rows are taken and the distal and the proximal sutures are pulled, and at the end of the surgery you can see we have created a round pupil, and this, lucky for this patient improved to 6/9 vision. This is 1 week post-operative vision with clear cornea. Uh, this is one of the patients whom I operated somewhere around in 2015. This patient had a very good vision of 6/6, but because of the trauma, the pupil was not constricting. So I plan to do an 360 pursing sutures for constricting the pupil. So first I inspect the iris and see how much tissue I can engage. Then a paracentesis, then paracentesis made at 3 positions here. One at inferior 5 o'clock, another at 10 o'clock, third one is at 11 o'clock. So we engage the margins of the iris with, and small bites of iris is taken, and you can see we are removing this needle from the paracentesis, and you can see at the end of the surgery there is a small pupil, and we have created an pursing suture at this stage. So this was a post-operative picture of this pursed string enhancement of the pupil. So micro scissors and forceps has become an important aid in construction of anterior segment, enhancing our results and making our life easier and happier for the patient. Thank you very much for your kind attention.
Dr. Gupta, for the audience, can you please tell what forceps were you using? What would you ask them to commercially ask for?
This is a 23 gauge vitreous forceps. These are end gripping forceps. You should have a flat edge of the forceps because then only it will catch hold of the sutures. You can also use glued IOL forceps, which has in serrated margins. And there are two types of forceps in glued IOL forceps which are available. One is curved and one is straight. So you can use either of the two forceps.
So do you prefer a metallic one or a disposable reusable?
You can use either of the two. Both the forceps gives equal hold to the suture.
So
But to cut, you need a 23 gauge curve forceps. Or there are multiple forceps which are available to create an rexus curved forceps now. So you can use those curved forceps also.
okay. Any questions from the audience? Yeah.
Putting in these forceps through the nasal paracentesis is very difficult because the nose.
Yeah,
Are there any tips the curve will?
that's why whenever you plan, you should either sit temporally or make a paracentesis on the temporal side. Other thing what you can use is if you are making a nasal paracentesis, because if you use a nasal paracentesis, then making the forceps horizontal is very difficult. So there are curved forceps, glued IOL forceps which are available, which makes the things easier, which you can tilt it to get hold of the suture.
Thank you, Dr. Gupta. That was quite an interesting presentation. Wonderful surgeries there for us to see.